11 million Americans suffer from a severe form of winter depression, and genetic testing can help patients get the right treatment based on their genetic profile. Here to help is Dr. Parikh. Thank you so much for joining us this morning, doctor.
Thanks for inviting me.
So why does depression often get worse during the winter?
Well, depression is a four-season disease. 19 million Americans suffer from it, but in the winter it flares up. You know, there's less sunlight, we exercise less, we socialize less. So all of these factors contribute to a spike in the winter.
And what kind of treatments are out there for depression?
There are many treatments out there that are good. Antidepressants are the most common and the most widely used, but they do have one problem, and that is finding the right medicine the first time out is often difficult. Less than 50% of the time you can get it right the first time, and often you have to go trying other ones through trial and error. And that's something that's just on the verge of changing now because we're getting tests to help guide us.
Now, why do so many patients experience high failure rates with their antidepressant medications?
Well, you know, historically, we just have to look at a wide range of medicines and say, well, maybe this will work for you. We haven't had any way of mapping on a particular medication onto a person's biology or their psychology. And so that's why less than 50% of the time, the first antidepressant you pick does the trick.
How do genetic tests help patients to get on the right medication sooner?
Personalized medicine is where science is headed right now. So we have available to us several genetic tests. GeneSight test is the most popular one, and that involves looking at 12 genes. Some of these genes govern how serotonin, a brain chemical, is processed. Others look at how the liver handles medicine. And you put the two together and you get a profile for an individual person that tells us, you know, for this person, certain medicines are in the green zone. That means they're well tolerated and have a greater chance of working. And so if you pick a medicine in that category, you double the chances of finding something that works first time out.
And that's how the GeneSight test works?
Yeah, that's how it works. So you get the test, which is not a blood test, it's just a cheek swab, and you send it off and you get the results back, and then the patient and the doctor look at the results and use, you know, usually the information about which medicines are in the green zone to identify which medicine to try.
All right, thank you so much, doctor. Great to have you on this morning.
Thank you for having me.
Hey, be sure to head online if you have any questions or want to see this segment again. We're at fox4morningsblend.com.